So the third therapy we're going to give today is that of oxygen therapy for Mr. Saunders.
Yep. So Penny will perform hand hygiene to prevent cross-contamination, and then we'll use therapeutic interaction with the patient. So this involves calm, gentle, confident and relaxed movements and tone of voice and talking to the patient, using closed questions to assist the patient to relax and become more cooperative. So Penny will breathe with the patient and will slow her rate down to be a bit more effective to relieve his anxiety levels and make the oxygen therapy a bit more efficient. Yep. Okay.
Right, so just before that we're just going to do a respiratory assessment on Mr. Saunders. So in that we just check his respiratory rate, abnormal breath rhythm and depth, his SATs. You also ask him, so I'll ask Mr. Saunders, what is your perception on your respiratory effort? Is it really hard to breathe? And then you just assess them on their ability to complete their ADLs. You can look for the breathing patterns and chest movements and clinical signs for hypoxemia or clinical signs of hypercapnia or oxygen toxicity whilst doing the therapy. Okay.
So this assessment can be used to gauge how much oxygen to deliver and what the best option is to deliver the oxygen. So Penny will go and document all the assessment in his notes, and will follow hospital protocol if anything is extremely abnormal. Obviously his normal limits will be a bit lower than others as he is a COPD patient. So Penny will now go and gather all equipment to deliver oxygen therapy. So Mr. Saunders requires 3 litres via nasal prongs as stated in the handover. So we need to remember that oxygen is a nurse's initiated medication, so we need to be quite careful as to how much we're giving, so close assessment when we're doing this. So nasal prongs is a low flow delivery system consisting of a plastic tube that extends across the face with short projections curving into the nostrils. So we tuck them behind the ears. So nasal prongs deliver 2 to 6 litres per minute depending on the patient's breathing patterns. They are inexpensive, comfortable and well tolerated as the patient is able to eat, drink and talk. This is particularly useful in Mr. Saunders' case as he has bouts of vomiting due to the ulcer. So the oxygen is provided through the wall outlets or through cylinders. They all need to be checked before, during and after use if they've got enough oxygen. Alright, so Penny will now apply the 3 litres. Yep.
So the prongs should then be inspected for mucus incrustations, and these should be cleaned off with water dampened cotton applicators. If the nares are encrusted, gently remove the incrustations and apply a lubricant. Once stable, the patient's ability to tolerate reduction and cessation of O2 is assessed regularly. The oxygen dose is gradually reduced and the patient is trialled on room air after 10 minutes of oxygen. Remain with the patient during this trial and assess their respiratory status. So in this, just make sure that he's comfortable, that there's no crustaceans, and you can also apply some type of Vaseline for nose and ear care because he's an 81-year-old man.
Yeah. Alright, so then we'll just see how he goes with the oxygen. As Penny said, we'll do the trial, so knock the litres down and then see how he goes. Closely monitor his oxygen sats and his rests. And that's it.